Our presentation today is going to be on respiratory syncytial virus, also known as RSV. Presenting will be me, Veronica, Elena, Angelica, and Melissa. What is RSV? RSV is a major cause of respiratory illness in children. The virus usually causes a common cold, but sometimes it affects the lungs and breathing passages and can cause breathing problems in infants and young children. RSV is highly contagious. It spreads through droplets containing the virus when an infected person coughs or sneezes. It also can live on surfaces like countertops or doorknobs, also on hands and clothing. So people can easily get this if they touch something that is contaminated. RSV infections are most common from fall through spring, but during the COVID-19 pandemic, they began early and lasted a lot longer. RSV can lead to bronchiolitis, pneumonia, and dehydration. People infected with RSV usually show symptoms within 4 to 6 days after getting infected. RSV will present as cold symptoms such as a runny nose, decrease in appetite, coughing, sneezing, fever, wheezing, short and shallow rapid breathing, lethargy, and irritability. These symptoms usually appear in stages and not all at one time. In very young infants with RSV, the only symptoms may be irritability, decreased activity, and breathing difficulties. At-home prevention. You can take steps to prevent the spread of RSV if you have colds-like symptoms. You should avoid close contact with sick people, avoid touching their face when unwashed hands, wash your hands often with soap and water for at least 20 seconds, cover your coughs and sneezes with a tissue or your t-shirt and not your hands, avoid close contact with others such as kissing, shaking hands, sharing cups, or eating utensils. Clean frequently touched surfaces such as doorknobs and mobile devices. And lastly, limit the time they spend in children's centers or other potentially contagious settings during periods of high RSV activity.
RSV is passed by the mother. Mother's antibodies are passed down through the placenta in some cases. RSV in pregnant women could affect outcomes of pregnancy because it can result in fever, respiratory distress, need for hospitalization, and even induction of labor. Red flags of RSV. Signs of serious distress if noticed: grunting, flaring nostrils, or congestion in infants that interfere with their ability to drink and stay hydrated. Shows signs of dehydration, such as fever, wet diapers than usual, or refuses to breastfeed or bottle feed. Has labored or fast breathing. Dusky or blue color changes to the skin are also signs of very serious breathing problems in the infants. There are treatments for RSV, which are 3 medications: acetaminophen, which is Tylenol, children over 2 months for fever, children over 6 months, acetaminophen or ibuprofen. Do not give aspirin or products that contain aspirin to any child. Ribavirin is only for hospitalized pediatric patients who have severe lower respiratory RSV infections. And last but not least is palivizumab. Doctors prescribe to premature babies and children with certain types of heart and lung disease. This medication may help prevent severe RSV. If a child is exposed, reduce the number of days a child spends hospitalized and reduces the number of days a child has been wheezing.
RSV can affect any age. Droplet isolation precautions. Droplet precautions means wearing a face mask, a surgical mask, when in a room with a child who has respiratory infections. There are precautions that are used in addition to standard precautions, which includes use of a face shield or goggles as well as gown and gloves if contact with blood or bodily fluids. Droplet precaution signs near the doorway of your room to alert healthcare workers and your visitors. Cleaning any toys as a child may come in contact with. Diagnostic procedures. Mouth swab or a blood test to check white blood cell counts and look for viruses. In severe RSV cases that require hospitalization, additional testing may be needed, which would include imaging tests such as chest X-ray or CT scan. Oxygen saturation test may be also done to check for lung congestion. Nursing interventions. Use of humidified air. Keep the room warm but not overheated. If the air is dry, a cool mist humidifier or vaporizer can moisten the air and help ease congestion and cough. Be sure to keep the humidifier clean to prevent the growth of bacteria and molds. Also encourage oral fluid intake. Keep a steady supply of cool water at the bedside. Offer warm fluids such as soup, which may help loosen thickened secretions. And ice pops may be soothing as well. Continue breastfeed or bottle feeding when your infant as you would normally, and administer medications or give prescribed medications.
So foods babies can eat. Foods babies can eat while having RSV is apple juice, cucumbers, water, popsicles, soup. And foods to avoid would be dairy, such as milk, cheese, ice cream. They can worsen congestion due to their mucus producing. Another to avoid would be meats, such as sausage, hot dogs, or ham. They're to be avoided with cough because choking can occur. Processed foods such as chips, cookies, canned foods can cause inflammation and worsen the symptoms. Fried foods, frozen foods cause overload of mucus production.
So facts about RSV. Antibiotics are not the answer for treating RSV. Antibiotics aren't used because RSV is a virus, and antibiotics are only effective against bacteria. It is often gets confused for a common cold. RSV can rapidly spread from the nose and throat into the lower respiratory tract, where the infection can cause inflammation in the tissues of the lungs and tiny bronchial air tubes. RSV doesn't just strike infants and children. It can strike a healthy adult and elderly over the age of 65. You can get RSV more than once. Unfortunately, just because babies has had RSV once doesn't necessarily mean that they won't get it again. RSV, like many other viruses, can strike more than once. Cases around the world. RSV can be very dangerous for infants and young children. Each year in the United States, an estimate of 58,000 to 80,000 children younger than 5 years old are hospitalized due to RSV infections. Children at greatest risk for severe illnesses for RSV include the following: premature infants, infants up to 12 months, children younger than 2 years old with chronic lung disease or heart disease, children with weak immune systems, children who have neuromuscular disorders, including those who have difficulty swallowing or clearing mucus secretions. Educating family members. Avoid kissing babies on the face and lips. Avoid contact with the child when sick. Hand hygiene is very important. This is our reference page. And thank you all for watching.